Hello, my name is Troels Madsen. Thank you for tuning in to my short talk on some preliminary results from our new study. Trials and exercise interventions for knee osteoarthritis rarely justify their research aim or contextualize study results in the context of a systematic review. A meta-research study based on a systematic review of randomized controlled trials. Why have we chosen to conduct this study? First, Oatman et al. In 2013 found in a systematic review that as of 2002, sufficient evidence had accumulated to show a significant benefit of exercise for knee osteoarthritis symptoms, and that further trials published after 2002 were likely to change this estimate. Some years later, Verhagen et al. 2019 found a similar result and stated that trials in exercise for knee osteoarthritis published after 2010 were at higher risk of being unethical, as new trials would be unlikely to change the overall effect size estimate for exercise. Yet, as you will see in a minute, trials have and are still being published. The second reason, prior meta-research studies on justification and contextualization have largely been conducted with cross-sectional designs. We expected that a systematic review design would provide a more complete representation of referral practices and allow systematic assessment of use of systematic reviews in relation to specific study characteristics and study quality. Therefore, the aim was to assess the frequency of appropriateness of inclusion of systematic reviews to justify research aim, inform study design, and support contextualization of trial results in randomized controlled trials and exercise interventions for knee osteoarthritis. To answer this question, we designed a systematic review with a new original search to identify all relevant randomized controlled trials on any land-based exercise intervention for any type of knee OA. We searched bibliographic databases, conducted citation tracking on included studies, and checked reference lists in all included studies. We included all randomized controlled trials on commonly recommended land-based exercise interventions for the treatment of knee osteoarthritis compared to any comparator. We included studies with any type of an EOA population or any duration of symptoms. Studies that included a combination of osteoarthritis from other joint areas were also included if knee OA specific data was available. We excluded studies with cluster randomized trial designs and crossover designs, and secondary analysis of original trials to aid interpretation of results and simplify analysis. The primary outcomes of interest were the total number of systematic reviews cited in the introduction section of the trial, the use of systematic reviews to justify the study and inform study design in the introduction section of the included trial, the use of systematic reviews to interpret study results in the discussion section of the included trial. Secondary outcomes were the proportion of appropriate justification and contextualization by publication year, total sample size, risk of bias, and the reported effect size estimates for pain. We assessed justification as follows. First, we counted the total number of referrals to systematic reviews in the introduction section of the included trial. Then we assessed the appropriateness of justification for the research aim and study design. Proper justification entail that authors refer to all relevant evidence to the research question in the form of an evidence synthesis of relevant studies or systematic review of previous similar trials. Prior research should provide the starting point for authors to assess whether the research question has already been answered elsewhere or if there's a substantial overlap with existing research. Therefore, we assess the study as providing appropriate justification when they use a systematic review explicitly to justify the value of the study and inform study design. We assess the study as providing partly appropriate justification when the authors referred to a systematic review but did not explicitly use the review to inform justification of the study or to design the study. We assess the study as providing not appropriate justification if they made no reference to a systematic review. To assess appropriateness of contextualization, we define contextualization as the attempt by authors to place the result of the study in the context of existing evidence to evaluate implication for clinical practice, highlight contribution of their study, and recommend priorities for future research. Appropriate contextualization was assessed when authors attempted to discuss implication of study results in the context of a systematic review and provided recommendations for future research and clinical practice. We assessed the study as providing partly appropriate contextualization when authors compared the results to prior evidence, but provided no discussion of reasons for possible differences in study results, nor implications for research and/or clinical practice. We assessed the study as providing not appropriate contextualization when authors only stated results of prior studies and did not attempt to discuss the study results in the context of prior evidence. Finally, we assessed possible associations between appropriateness of justification and contextualization with year of publication, total sample size, risk of bias assessed with ROB Tool 2, and we conducted a meta-analysis and meta-regression analysis to assess reported effect size estimates for pain. Overall, 268 studies were included in this preliminary analysis, identified through database searches, forward citation tracking, and reference searches. The preliminary results of this study show that 73% of included trials reference at least one systematic review, but only 31.7% of authors integrated the review to support the value of the research aim and to inform study design. 157 trials, 58.8% total trials, did not reference a systematic review in the introduction section. For contextualization, we found that 68 studies, 26% total studies, attempted to integrate study results narratively with a systematic review. 274.6% of total studies made no apparent attempt to integrate study results in the context of a systematic review. Only 53, 19.8% total studies discussed study results in context of existing evidence in systematic review and provided recommendations for clinical practice and future research. And 183, 68.3% of studies did not refer to a systematic review to discuss reasons for possible differences or similarities of study results and did not provide recommendations for clinical practice and/or future research. Additional analyses for justification indicated that trials with less appropriate justification reported smaller sample sizes, were generally assessed with higher risk of bias, and reported markedly higher effect size estimates compared to trials with more appropriate justification. Similar results were found for contextualization, where trials with less appropriate justification reported smaller sample sizes, were generally assessed with higher risk of bias, and generally reported slightly larger effect size estimates compared to trials with more appropriate contextualization. Summing up, Verhagen 2019 stated that studies on general exercise interventions for knee osteoarthritis published after 2010 could be deemed unethical because new studies were unlikely to change the overall effect estimates for exercise found in Cochrane reviews. Using this estimate, 125 out of 188 studies, that is 66.5% of studies published after 2010, could be deemed redundant and therefore unethical. Trials with less appropriate justification and contextualization reported smaller sample sizes, larger effect estimates, and were generally assessed with higher risk of bias compared to trials with more appropriate justification and contextualization. Authors of clinical studies should systematically and transparently identify the present evidence before engaging in new studies. The inclusion of patients in a trial where the present best evidence is not assessed is a waste of resources, unethical, and scientifically unacceptable. The evaluation of all studies related to the same clinical research question, exercise for patients with knee osteoarthritis, showed not only a bigger problem in referring to the existing evidence, but also indicated a relationship between smaller total sample sizes, higher risk of bias, and larger effect size estimates reported, and a lack of appropriate justification and contextualization of included studies. Thank you for your attention.